All right, let's move into this interview that we've been promising you. When President Cyril Ramaphosa said that South Africa will only receive a vaccine or a COVID-19 vaccine in the second quarter of 2021 as the COVAX agreement, it raised many concerns from ordinary people and medical experts alike. Why is government taking so long? Who are the pharmaceutical companies that we are talking to? Where is this urgently needed protection for our frontline workers in hospitals and thereafter for us, the population? These are just a couple of questions that are being asked. Now, in response to this, civil society is galvanizing support for a coalition demanding a vaccine action plan. Joining us to discuss this, we've got the editor of the Maverick citizen and social justice activist, Mark Haywood, with us. Good to have you, Mark. Thanks so much for being with us.
Good morning, Leanne, and thank you for having me.
All right, so let's have a look at the C19 People's Coalition and the People's Vaccine Plan. Perhaps you can tell us a little bit about this.
Well, the C19 People's Coalition is a coalition of about 350 or 400 NGOs, social justice organizations that have organized around COVID-19 from the earliest days when this pandemic hit us. They've organized around food relief, they've organized around community education. And now, like many other parts of society, they are expressing concern about the long time frame to get a vaccine distributed within our country. You know, they're not alone. I talk a lot to medical practitioners and to clinicians. They are up in arms about this time frame of June 2021. The trade unions are up in arms, and I think it's all for good reason, because, you know, yesterday, 17,710 new infections were reported, 495 deaths, I think. You know, we're not even at the peak of the second wave. We look into 2021, we consider the possibility of a third wave and a fourth wave, and a vaccine is a critical component of breaking this pandemic. So we don't want to find ourselves, as we did with HIV, as we have done with TB and other diseases, at the end of a long queue when so many people now are vulnerable, so many people are being infected and so many people are dying. And one thing I should say, I mean, you mentioned President Ramaphosa said second quarter 2021. Dr. Pillay, who you'll be speaking to later, yesterday said the 20th of June is the date that has been promised by COVAX for a delivery of a small amount of vaccines. It's just not good enough. We can do better as a country. We believe that with a sense of urgency, that with the involvement of the whole of society, with a more robust approach to the pharmaceutical companies demanding that they play ball, that we can make something happen much earlier.
Yeah, I mean, that is concerning, and I definitely will quiz him on that, the 20th of June now, suddenly being pushed out to even further into next year that we'll get this. But we'll question him on this. Now, when civil society says it demands a vaccine action plan for the most vulnerable, who is it that we're referring to here?
Well, I think our most vulnerable at this moment are obviously frontline healthcare workers, people who work in clinics, people who work in hospitals, whether it's as porters and security people or whether it's as treating doctors and nurses. On a daily basis, those people are being exposed to this virus, and they are exposing themselves in all of our interests. And I think across the world, the prioritization of healthcare workers is common to many countries. But then, you know, in a country like ours, where we have epidemics of other diseases, what the word that we've all become accustomed to, people with comorbidities, diabetes, hypertension, and so on, HIV, then we need to put those people at the front of the line as well. But that's what we are saying, Leanne, is that there needs to be a public discussion and a public debate, because every one of the 55 million or 59 million South Africans has a direct interest in this vaccine. So every single person, certainly every single adult and young people, should be involved in this conversation. And what we're also saying, or what civil society is also saying, is that procuring the vaccine is one thing, and that needs attention. But what's the plan for distribution? Once we have, say next week we have 2 million doses of vaccine in our hands, How are we going to get it out to the people who need it in the country? We shouldn't be waiting to have that conversation until we have the vaccine. Those plans should be in place now, or we should be developing those plans. Similarly, Leanne, we should be embarking now on a campaign of mass public information and education to encourage people to take the vaccine, because we're seeing reports of 40% of people saying they wouldn't take the vaccine. There's a lot of misunderstanding, a lot of misinformation, a lot of fear. We have to use this gap, this time that we have now, to lay the foundations for a successful vaccine rollout when we obtain it.
Yeah. Government would argue and say that they have already been talking to a plan of rolling out and, frontline workers, the elderly. I saw even, I think, fourth on the list are prisoners that are serving time, that they would be up front to get this vaccine. So there is kind of a list out at the moment.
Well, kind of is not good enough. It needs to be. There's a legal duty to be transparent. This is a constitutional question, if you like it. There are parallels with the case I was involved in 20 years ago around the treatment action campaign and access to nevirapine and antiretrovirals. A kind of a plan is not good enough. We need an actual plan. I would like to see, for example, Dr. Mkhize, together with our best virologists and vaccinologists, to hold one of their media briefings over an hour and a half, and to tell us, these are the companies that we are negotiating with, these are the vaccines that we are considering, these are the obstacles, etc. Take the country into your confidence about what the challenges are. Just a few words thrown in here and there. We are negotiating with some companies. But you don't tell us which companies you're negotiating with. You don't tell us what you're negotiating for. It is simply not good enough at this point. We will, or civil society will all get behind the government, particularly if the government says we have a problem because the pharmaceutical companies here are pursuing self-interest and profit rather than the health of people in developing countries. I mean, you might want to ask, Leanne, when you speak to, I believe you're speaking to Professor Schub later on this morning.
Yeah.
My understanding is that the pharmaceutical companies have not even made applications to the South African Health Products Regulatory Authority for use of the vaccines that have been approved in other countries. Why not? Is the reason because these companies know that they can make fabulous amounts of money in Canada and the United States, etc. So they're not bothered. There's no sense of urgency. These are all questions of public interest and public importance. And that's why all of these civil society organizations are now saying we've got to do better, and we want to see our government doing better on our behalf.
What do you believe, Mark, is behind the secrecy? Because, I mean, these are questions that are so important for South Africans to have answered. And, the reality is that we're actually seeing so many, and we'll get to the developed countries and not even developed countries. I mean, we're seeing lots of countries that are rolling out, and they are being already doing mass testing on the populations and actually going out there and protecting. However, we are very sort of murky about this. Why do you think we are not having this information coming out there that we can actually hang on to and say, okay, guys, we're fine. This is the date. This is how it's going to work. And the secretiveness is just something to be concerned about. What do you think's behind it?
I don't know. I think that's a question you have to ask Dr. Pillay, and perhaps also Dr. Schub, who's the chair of the Ministerial Advisory Committee. The government has been very open about COVID-19 as a whole. So why this secrecy on this question of the vaccine? I don't know whether they feel that if they tell us which companies they are negotiating with for vaccines, what exactly they're asking for, what prices are being discussed. I don't know whether they think that will jeopardize negotiations. It shouldn't. These are matters of public interest. But I can only guess. But what I can say, and I think you would agree, and what civil society is saying, is that we just don't have enough information. And to withhold information about something as important as this is actually unlawful. It's unconstitutional because people are at the moment living with a huge amount of understandable anxiety about how they and their loved ones are going to get through the next few months and the next year of this frightening epidemic.
Yeah, and also healthcare workers, because I've seen so many healthcare workers calling out and saying they're not sure that they can actually last until the second quarter of next year, or even further, before they have something given to them, because it is something that they're very worried about. Before we continue,
we're exhausted, and
absolutely.
We've lost health workers as well. We've lost a generation of expertise in our health system. It's something I've been following quite closely through Maverick Citizen, and nobody has really tallied the number of healthcare workers who have died. But I can tell you that it's a significant number, and it will have ramifications for health service delivery for many years to come.
Yeah.
So I'm in 100% agreement with you.
Yeah. So let's have a look at the issue of developing countries. So, they are being, I suppose, what is referred to when we look at the greed of a big pharma, and also of developed countries stockpiling vaccines to the detriment of developing countries. Now, where COVAX and the World Health Organization were they simply too late in starting to make deals, or was it our own government who was too late?
I think it was a bit of both. COVAX is a good initiative in theory. But something that's good in theory needs to show that it can deliver in practice. And I think what they've done is they've taken a sort of apolitical, idealistic view that thinks that there will be altruism and generosity on the part of developed countries and on the part of pharmaceutical companies. And I'm afraid that history in the last 20, 30, 40 years has told us, don't expect altruism from pharmaceutical companies. Don't expect that they believe in equity and equality. What they believe in is the dollar that they get for the vaccine or the drug that they develop. And that will ultimately be the determinant of policy, which again is why, South Africa has to rally with other developing countries and assert our legal powers to demand, for example, that the biotechnology of vaccines is made publicly available. It's what we would call a global public good. It shouldn't be treated as a private good when so many hundreds of millions of lives are dependent on it. We talk a lot, and there's a lot of rhetoric and bluster about profiteering by pharmaceutical companies. But when it comes to using the powers that we have, that our constitution gives us, to force these companies to deliver, we don't do it. And one thing, Leanne, I would say to you is, again, people say, well, the companies have no capacity. The companies, that they can't meet the demand at the moment. But we just believe them when they say that. I remember in the days of AIDS, when the companies used to say, we can't sell AIDS drugs for less than 5,000 Rand a month. But when it came to pressure, they were able to sell AIDS drugs for less than 1,000 Rand a month. Now AIDS drugs cost less than 200 Rand a month. So I'm afraid you can't take anything at face value when so many lives are at stake. Every single question has to be interrogated because we have a right of access to healthcare services, and because so much about our country's future and our people's future depends upon getting access to this vaccine and to other therapeutics and to our day-to-day response, which we mustn't, of course, forget. And no one's suggesting about hand washing, mask wearing, etc. It's this combination of strategies. But we need to combine strategies. We can't say to people, okay, for you it's masks and hand washing and social distancing, And for developed countries, it's masks and hand washing and social distancing plus vaccine. That tells us that the world is not an equal world.
Well, we kind of know that already, but this is just highlighting it once again, how unequal it actually is. In fact, there's a New York Times article that's doing the rounds, which is a really, really interesting read, if not a little bit, difficult to read from a South African perspective. I have put it out there on Twitter if you'd like to read it. But there's just one part that gets to me where it says, a few months from now, a factory in South Africa is expected to begin churning out 1 million doses of COVID-19 vaccines each day in the African country hardest hit by the pandemic. It goes on, but those vials will probably be shipped to a distribution center in Europe, then rushed to the Western countries that have pre-ordered them by the hundreds of millions. None have been set aside for South Africa. Finally, it says the country which will help manufacture the vaccine and whose citizens have enrolled in clinical trials does not expect to see the first trickle of doses until around the middle of next year. By then, the United States, Britain and Canada may have vaccinated more than 100 million people. And that's thanks to us manufacturing and yet not receiving. Now, that kind of, I throw my hands up and say, how is this happening?
What can we say? I mean, I've seen that New York Times article. I know the company. It's Aspen Pharmacare, and again, it's like holding out a plate of food to a starving person, and then saying, "No, this plate of food, you can smell it, you can see it, but I'm going to send it to some people who probably already have food." It's just wrong. It's immoral. It's plain wrong. And again, it takes us back to this question of transparency. Why are these negotiations, why are these deals being done in secret so that we can only find out about them after the fact and then raise our hands in shock and anguish, but have apparently no power to do anything about it? The pharmaceutical companies and these manufacturers have to do better.
Yeah. Just finally, and very quickly, because I've got to wrap and take a break before news. In your article, you ask a question, why the Medical Advisory Commission excluded leading scientists like Professor Glenda Gray, who we've spoken to many times, and vaccinologist Shabir Mahdi, both of whom are principal investigators on clinical trials underway in South Africa. I mean, is it simply politics? What difference do you think they could have made if they were part of this?
Well, they have deep expertise and knowledge in this field, particularly now in this field of vaccines. It does seem that when the ministerial advisory committees were restructured 2 or 3 months ago, a decision was taken by somebody to remove outspoken and inconvenient voices from those ministerial advisory committees, because, as you know, both Dr. Mahdi and Dr. Gray have at times felt compelled to speak publicly, as they should, as is their duty on these issues. But again, that's the problem is we can't afford politics. We can't afford game playing with these type of things. We need all of the views of our scientific community to be combined into the advice that is given to the government, and then that advice gets turned into practical action. Perhaps ask Dr. Pillay that, or ask the chair of the vaccine advisory committee, Professor Shu, whether he thinks that he has all of the country's expertise at his fingertips in his advisory committee.
All right, I'll do that. Mark, thanks for talking to us. That's all happening in the next hour. You've given us a lot of food for thought here this morning, and we'll certainly pass those questions on. Mark Haywood, editor of Maverick Citizen and a social justice activist, talking to us about civil society demanding to see an action plan to get COVID-19 vaccines to the most vulnerable. All right, let's quickly take a break.